welcome to, I can't get rid of that. I don't know what, how do I, okay. Welcome everyone. Welcome to Relume Foundation's COVID-19 Q&A, strategies for getting back to normal. All right, so this is what the topic is going to be this evening. Of course, everyone has heard on the news already that most of, if not all of the mask mandates are suspended. I can't admit anyone, Sherry, I don't know. Whenever I go into this mode, I can't get my mouse to work. So I can't get him in. So everyone has heard that the mask mandates, most of them have been lifted, and the COVID rates are very low. Again, I don't know why. Okay, so this is the update citywide. We overall citywide, the rates are at about 1.4% transmission. So we are not zero transmission, but this map describes the areas where the transmission rates are still very high. And I would bring your attention to the bottom of the screen where that little strip of barrier reef is circled. That barrier reef is called the Rockaways, Far Rockaway. And as you can see, the transmission rate there is still very high, ranging up to 4.7%. And then there are parts of Staten Island, other parts of Queens, and some other areas where the transmission rates are very high. So we are not at zero. So one of the strategies that I would encourage you to follow is to know what the transmission rate is in the areas that you are frequenting, okay? Because that's going to help you to decide what to do in terms of personal protection. So if you are in the Rockaways, as you can see, transmission rates are very high. So I would, despite the recommendations of masks being dropped, I would take note of this transmission rate and govern myself accordingly in terms of wearing masks and washing hands and following all the guidance that that we've been following throughout. Wait a second, I don't know what's going on here. I don't know why the slides are out of order. Okay. All right, so the citywide vaccination goal is still to fully vaccinate 70% of New Yorkers, and in the equity areas of inequity, racial inequity, the goal is still to reach full vaccination at 70%. So that brings us to Far Rockaway again. So we, upon further analysis of the data, Far Rockaway is at a standstill. We've been at 67% fully vaccinated for the last 2+ weeks. So that number hasn't budged. They'd hoped that it would have reached 70%, but upon analysis of the latest data, and this is as of yesterday, the Rockaways are still at 67%. Okay, and this slide here, which I'm sure Sherry will add to later on, this is schools this is the rate of vaccination in schools in areas of inequity and areas of or non-tree areas. So the blue is tree areas, and the orangey color is the non-tree areas. And these are the schools that are below 70% vaccinated targets. And as you can see, those numbers are really high. So 83%, 66%, 92%, 78% are below the target of 70% vaccinated. And so, and in the percentage of schools that have reached, so these numbers are just very, very low. So 17% of schools in tree areas have reached 70% vaccination, and 34%, even for non-tree zip codes, those numbers are very low for one dose and fully vaccinated. These are very low numbers. So this tells us that our children that are eligible to get vaccinated are not being vaccinated, and therefore are at high risk of contracting COVID. Because remember, COVID is not zero transmission. Okay, so the goals again are to have 70% of all Black residents fully vaccinated, to have tree zip codes, have the children, the teens, 13 to 17 fully vaccinated. And then the third goal is to have the 5 to 12-year-olds fully vaccinated, so 70%. So we still have goals to reach. All right, this I thought was a very interesting map that they shared, because it actually drills down Far Rockaway, the 11691 zip code of which we are in. And it shows our name is listed here. If you look at the green dots, the partner CBOs and where we are located. So there's Rockaway Waterfront Alliance, or RISE, Relume Foundation, Jewish Community Council of the Rockaways. So you can see where we are located on this map. And then in relationship to the vaccination hubs or sites, so which are mainly St. John's Episcopal. And then we have some private, a private provider who has been very successful at vaccinating young children 5 to 11 years old, Margaret Safo, and then Adabo, Joseph Adabo, and the Beach 39th Street site when it was there, the vaccine hub and the van when they were there. They were successful at giving 900 doses to children. And then you can see what the other sites are. The purple sites are clusters or high density population sites, okay? And that's where the efforts need to be focused on. The green and the light green sites are fully vaccinated or near fully vaccinated. But those dark purple, intensely purple sites are high concentrations of people with low vaccination rates, okay, especially among children. So this map will help us, our team, to determine where to best place our resources in relationship to where we are on the map and where these locations are on this map. So we're going to use this to really help us in our efforts to get our children vaccinated. Okay, so this is where Sherry, you want to weigh in on this. So the mask updates. So starting today, Masks will be optional for students and staff, regardless of vaccination status. The governor announced that masks would be no longer required in private schools as of last week. In January, the governor removed mask or vax requirement for businesses or other private institutions. Businesses may choose to leave mask requirements in place. Masks are still required on public transportation, healthcare, and other congregate settings. There's been no change to the city childcare mask policy, and children under 5 are still not able to get vaccinated because the vaccines are not available. So the key to New York suspended today. That means that proof of vaccination is no longer required for indoor dining, entertainment, and fitness. But the vaccination requirements for private employers, childcare, high-risk extracurricular activities are still in place. Okay, so I think it was it back in, I think it was back in December or January, December, where the city put out this ordinance regarding private businesses. If you have one or more employees, you have to show proof of vaccination or place those employees in areas where they would not be facing the public. So, and then the other thing is that the vaccine is efficacious, meaning that the vaccine works. And so they did a study at Yale University in collaboration with the New York City Department of Health and Mental Hygiene. And in this study, they showed that approximately 48,000 deaths have been prevented because of the use of vaccines, and over 300 hospitalizations averted, and more than 1.9 million cases prevented as a result of New Yorkers doing right by their city and getting vaccinated. So the strategies remain the same to get back to normal, and that is to pay attention to what's going on, wear your mask in situations where there may be high risk of transmission, and in areas of high risk of transmission, get vaccinated, because we know the vaccines are effective in reducing COVID transmission and reducing hospitalizations and deaths due to COVID if you are vaccinated and you still get COVID. So the other thing to mention tonight is that the incentive program has ended. So no longer will you get $100 for getting your first dose or your booster at a city-run vaccination site. And I wanted to show the slide that's out of sequence. Okay. So this is the slide that's out of sequence. So the White House announced today the White House site, test kit site, is reopened so that you can get a second set of test kits from the White House. And being that this is Women's History Month, I've shown you some photographs of some wonderful Black women. I hope that you can identify a few of them. Anyone who can chip in and tell me some names or put some names in the chat. You know, front and center, of course, is Michelle Obama, but we've got some other people up there. So if you can name somebody, there's all you'll get is a clap and great, but let's see how many people you can name, if we can name them all. Anybody want to see some names and let me know who is?
I can name them.
Okay, go ahead.
Maya Angelou, starting left to right.
Okay.
Maya Angelou, Madam C.J. Walker.
Yes.
Rosa Parks.
Yes.
Harriet Tubman,
Yeah.
Shirley Chisholm.
All
Of
right.
course, Michelle in the middle.
Yes.
I see Ida B. Wells, Coretta Scott King.
Yes.
I see Condoleezza Wright. I
Yes.
see Bethune, Mary
Yes.
McLeod Bethune. That's
Yes.
it.
Okay. Anybody recognize who did he miss?
He missed Mae Jameson and Oprah Winfrey.
Oprah Winfrey.
Yes. Yes, those are all the wonderful women, Black women who have contributed to the country and lent their talents and their gifts to this nation. So we just want to acknowledge them tonight. Okay, Sherry, back over to you.
Excellent, excellent, excellent work. Let me just share a little bit about the mask. I think you mentioned something that is really vital, talking about the risks of transmission, being mindful of the transmission rate in the areas that you go to, and allowing that to really help you determine whether you want to keep your mask on or you want to take it off. I think I want to really stress that I don't want us to feel pressured to like take our mask off if we're not comfortable. I think we mentioned it last week, is a journey that we are all going through. If you feel like you're not comfortable yet to take it off, or especially you're going to an area that have high infection rate, it's okay to keep it on. Don't let anybody make you feel like, why are you still wearing your mask? I thought we could take it off. It's an individualized decision, because at the end of the day, if you get sick, or if you have a family that's immunocompromised, you know, you have children, little kids that are not vaccinated yet, then you are the one that has to deal with it. So just be mindful of that. And talking about the plan for the school system, as Dr. Coney rightfully mentioned, the mask is optional. That means they may or may not wear it. They're not going to force anyone to wear masks in the school. But at the same time, if your child is sick, your child is not feeling well, you don't want to send them to school, just like even before the pandemic. If your child has a fever, you want to keep them home. And most especially during the pandemic, since it's facing now, but still you want to be mindful of if your child is sick, if you're sending them to school, or if they're getting better already, if they have a little cough, you want to let them wear their mask, because you don't know what it could be. That's why we're widely sharing and giving out the testing kits, so that way you can test the kids. A lot of the testing sites in the community have been closed down, but there are tons and tons of testing kits. Nobody should be in want of testing kits. If you need testing kit, please reach out to us. Excuse me? If you need testing, can reach out to us and we'll be able to find ways to get it over to you. So I think one of the next strategy, even as we unmask, is to test before you still do big group gathering, places that you haven't been to, people you haven't been around. You want to be intentional. I don't want us to just be too relaxed. I know we want to go back to normal way. So eager, right? Dr. Cody need to go back to normal. But in that same token, we want to be careful so that we won't have a return of December. So we just continue to pray, continue to watch over each other, and be mindful of the policy and the protocols that are in place. And the other thing I want us to be mindful of, for those that have young people in your life, just talk to them about taking off their mask, because it's not just safety for the little kids, for the young people, for the teenager. Some of them actually have sincere concern of taking off their mask because they're used to covering their faces. Now, they have to take off the mask. Some might have concern. I actually was speaking to a young person, actually not the young person's mother, and she was telling me that my daughter is not ready to take off her mask because she was telling me that someone in her class was like, "Oh, I'm sure you don't look good back there. I know when you take off that, but you're going to look really ugly back there," because she's in middle school. Since she's been in that school, nobody has really seen her face because she was in a different school. Now it's a new school for her. Just imagine that. So that safety of that vulnerable stage in their life. And now, okay, you have to take off your mask. That's almost like and exposure. So be mindful, have conversation with your grandchildren, with your children. Don't just assume they just don't want to take off the mask because they're just trying to be safe. Just engage them in conversation and try to figure out how we can actually support and make this transition good, be mindful of their mental health. That's one thing I wanted to mention. I don't know if anybody have any question regarding the new mandate and masking off, that is going on, and how do you guys feel about it? In the buses and the trains, it's still mandatory for you to wear your mask, So, but in other setting, we're taking it. Oh, go ahead, Mr. Brenner.
Yes, good evening, everyone. It's confusing, okay? They want us to get the zip codes, everybody get vaccinated, and now they throwing this, like, take off your mask, and then a lot of people still not vaccinated, and then they said they could come and eat around you, and they still not vaccinated. I mean, it's very confusing. You know what I'm saying? So that's why sometimes people don't want to, they be like, oh, I don't believe it, because now all of this is uplifting and everybody's still not vaccinated. How do we actually approach people now? Because they're going to throw that hard in our face now. I already know that, especially where my location at the train station. They're going to say, see, it didn't pay off to get a vaccinated because they uplifting this and they uplifting that.
Well, the rates are still high in Far Rockaway. You see the rate of transmission is almost 5%, whereas for the rest of the city, it's under 2%. So because folk in Far Rockaway have been hesitant about getting vaccinated, the infection is still traveling among the residents of Far Rockaway. So you can point that out to them. You can say to them, if you look at the information, Far Rockaway still has a high rate of infection. So you still need to wear your mask, okay? And they should wear the KN95s that we're giving out. If they have the surgical mask, they can put a cloth mask over it. But we're really going to encourage them to wear the KN95s and to get vaccinated and to get 11691 down to a slow or low rate of transmission of infection. 5% is still high. We were hovering around 5% right before Omicron hit. That's why I had gone out and gotten the KN95s for the staff, was because I kept looking at 11691, and those rates were just lingering at 5%. And that's a high rate of transmission. So you can tell them that, the Rockaways are not among that group of low transmission and where you should feel comfortable taking off your mask, because infections are still running high in the Rockaways. So they need to get vaccinated and try to bring down the Rockaways so that it matches the rest of the city, so that they can get down to the 1%.
I think the other point we also need to reinforce, we said it before on this platform, is the fact that when you get vaccinated, it's not excluding you from getting infection. It just reduces the severity of it, and the data supports that. So that is still stands true, whether we're unmasking or we're not unmasking, that is still the fact. So the possibility of you getting infected, is higher, of course, when you take off your mask, but the possibility of you getting really sick if you just get the virus is lower, is reduced because you're vaccinated, compared to someone that is not vaccinated and they're unmasking, they put it themselves at a greater risk. So that's also something you can share with them, that because you're not vaccinated, you actually should be cautious in even taking off your mask faster if you're not vaccinated compared to those that are vaccinated, because you're exposing yourself and then you could get sicker, faster. If you get the virus, your sickness could be worse. And the data say most people that die from hospitalization, they are those that are not vaccinated.
So, okay, my next question real quick is, okay, so they doing what they doing. Are they still gonna take the temperature when you come stepping in the restaurants? Do you
Well,
know anything about that?
now it's up to each business to decide what they want to do. So it's left up to the way the governor put the rules out. It's up to each business to decide what they want to do in terms of requirements, in terms of wearing a mask, in terms of taking a temperature. It's up to each individual business. So yeah, so that's where that stands now. So, you might go into a restaurant, they may say, we're requiring masks, we're requiring temperature checks or whatever. Then you go into another restaurant and they don't want any of that. But it's up to that individual business to make that decision.
I mean,
Gotcha.
one thing, before I take all the questions I see your hands, Sister Sharon and Sister Rosie. I think one thing I'd like to remind us of is when we went back in December and the school reopened and the Omicron was like going crazy. A lot of people were against schools reopening, because the numbers were crazy high, but the mayor was determined to keep the schools open. We can agree or not agree with his decision, but the fact is the decision kept the kids in school, because it was at the point where we had to decide between the mental health of the kids, the education, or we're gonna just keep them safe. It was like a difficult battle to decide which way to go, and things like that. But anyway, he decided to keep the schools open, but there was still challenges because the kids were going to school. Even when they reduced the number of days that they have to quarantine, it was still a challenge because it was reduced from 10 to 5. Some kids may still have symptoms and they're going to school, but we pulled through that. The infection rate in the school did not increase astronomically. So it's something that has sort of been tried, but now we're going to this phase where we're all being encouraged to mask in the safe way. Just remember those little things to guide you. What is the risk of transmission where we're going? It's not like general the same across the city. They can say it's an average of 2.5, but that area where you live in, that area where you work, what is that particular rate? That data is easily accessible in the, you can go on the Department of Health website, NYC1, and you'll be able to find that information for the specific area that you live. Like Dr. Cronin mentioned, it's high in Farakowee area, it's 5 point something. So I would encourage you to still keep your mask, if you live in the Farakowee area. And then the number might change. We're hoping that the change, we hope that our effort of canvassing, I don't think we should reduce the pressure. We should reduce the rate at which we canvass. We should actually increase it, because now mask is being off. We should just be more strong in our messaging and be intentional. We have to find strategies to be able to get more of our kids vaccinated, because we know the young people, they touch and touch and touch everything, and we can see from the data that a lot of them are not vaccinated yet, and that's because maybe the parents are not buying it, and it's going to trickle down to the kids. So we need to just really manage our messaging and be mindful, your sphere of influence, let them know, because we are masking doesn't mean we shouldn't get vaccinated if we are not.
One thing before you go to the questions, I had a discussion with some of the teachers and and school personnel, and one thing that they mentioned, which is a way that you can think about this, is flu rates, influenza rates have dropped. This is 2 years running that influenza has been very low, and other infectious diseases like RSV, respiratory syncytial virus, which goes around with children and stuff, all of those things have been very low. Why? Because we've been wearing masks and we've been washing hands. And so a lot of those cold viruses and stuff have been diminished because of that. So that's something that some of the teachers are acutely aware of, because they're like, I haven't had a cold in 2 years because I've been wearing a mask. Okay. And that's something you might want to look at with your children also. Hey, my children haven't been sick, getting all of these colds and runny noses and stuff. You know, why is that? Because they've been wearing a mask and they've been sanitizing their hands. So that's also food for thought, or a way that you can tell people about the benefits of wearing a mask. So, okay. We have questions.
Thank you. I'll take Sister Sharon's question and Sister Rosie and Avermax. Sister Sharon.
What is the decision now for social distancing? Are they going to continue that, or if it's left up to the individual, how are they addressing that?
So the social distancing, again, depends on the congregate setting and just how close people are, what the rates of infection are within that community. So that's how they phrased it. They haven't come out and said you can drop social distancing. They're leaving it again up to your judgment, up to your discretion, depending on the situation that you're in. So that's the way it is for right now. Sister Rosie?
Wait a minute. I remember there was a study, it was a Harvard professor that said a while back, when are we going to learn that that when we opened up and said that we're doing better, and then all of a sudden we had to go backwards. He said, what are we going to learn? But anyhow, I just want to say from my heart, I feel sorry for you guys. You're working around the clock, and all of a sudden you get this, and you guys are very calm about it. And I mean, it's taken all in my just to get people to wear a mask and to get vaccinated. And right now, I feel like it's like everything's thrown up in the air. And my heart goes out to you because you guys have been working so hard doing this.
Well, you know, this is not a point of sadness for us. This is actually the point that we've been working towards, is to get people back to a situation where there's less pressure in terms of wearing masks, in terms of meeting with your family and your friends, you know, and having gatherings and things like that. This is where we've been headed to. But what we know now is that we are not at zero. So the strategy is, how do you manage yourself, knowing that we have to now live with this virus? Okay, this virus has proven it is not going any place. All right, this virus has beaten us into submission. Okay, but we have strategies available to us. All right, we are the wiser. We are not going back to where we were before COVID, because we do know that we're wiser. We have to look and see where we are. We have to see who's close to us. If we know who's vaccinated, who's not vaccinated, if someone's coughing, sneezing, you know, all of that. All right. We are still carrying our mask with us and whipping that mask out and putting it over our face. Okay. We are still washing our hands. All right. So we've learned a lot, okay, since this whole pandemic has started. And we are glad that we have come to a point where we can drop some of the mandates. Everyone is tired, you know, of everything. But in the meantime, we still learned lessons, and we have to ingrain those lessons within us. And so when we come into those circumstances, those situations, we know what to do. We're not helpless. We're not hopeless. Okay. We know if you're in a crowded situation and you don't feel comfortable, put that mask on, regardless of what anybody says. Forget about peer pressure. Forget about, you know, differing opinions. This is about the knowledge that you've gained and what you know and what's right for you. and you know that I'm going to do this. I don't feel I don't care what you say. All right. And you know, the young people say, you do you. Okay. And I'll do me. So this is where we are. I'll do me. I don't care what you say about, oh, why are you are trying to pressure me or bully me? Okay, bully me into not wearing a mask. Don't do that. Don't bully me. I have rights just the same as you. And it's my right to wear the mask or my right not to wear the mask. But if I don't feel comfortable, I'm going to put that mask on. Okay, I don't feel comfortable. I'm not going to be shoulder against you, shoulder to shoulder against you. All right, I don't feel comfortable with that. All right, I am going to carry my hand sanitizer and sanitize my hands when I can't get to a washroom to wash my hands properly. That's it. And that way you keep yourself safe because you have the knowledge. You know, we have the sermon, knowledge is power. Well, guess what? You know that it's not zero. We can never go back. All right. COVID is here. We can't go back to pre-COVID. It is here. It is with us.
Yes.
All right.
Yes,
and so
right.
we strategize as to how we are going to live our life. We have the test kits, as Sherry mentioned. So before your family gathers, you haven't been with that person in a year. Okay. I'm sorry. This is what I told one of my friends, my house, my rules. You want to come into my house for the gathering? Guess what? You do a test. You don't have a kit? Here's one. You can do this COVID test before you come in to my gathering to make sure that everyone who's there will be safe. That's where we are. So.
Absolutely. Absolutely. So Sister Rosie, even as Dr. Connie said, is not a thing of sadness, is the journey we're traveling to bring us back to normal, but even in doing that and getting to this place where we have the possibility to even take off our mask, we don't want to forget, that we're still, it's still not zero. We're not at zero. And because we're not at zero, there's still a risk. So this virus is becoming endemic. So it's something that's going to be with us, just like the flu. So based on what the science is saying and all the data that's out there, is going to be with us for a while. We're not going to be able to get rid of it in the nearest future, but it might have been easier to get rid of it if more people had been vaccinated faster. But because people took their time, people didn't believe in the science, it continued to mutate. So what we're gonna just continue to pray for, that we don't have another variant, and if we do have another variant, we pray that it will be mild. So those are the areas that we have to focus our attention in. And while we're in between trying to figure out the effects of this masking, we still need to be careful of those little things so we can be safe.
Yeah, and we don't know yet. So this is the decisions that we're waiting for. The COVID vaccination may become a yearly vaccination, the same way that we encourage people to get the flu vaccination on a yearly basis. So we still have to wait and see in terms of if this will become a routine part of your healthcare. So when you go to the doctor for your annual and they offer you the flu vaccine, they may be offering you the COVID booster as well. We don't know yet, but don't be surprised if come the late summer into the fall, when we start pushing the flu vaccine, if they say, well, you know what, it's time for a COVID booster. So this is the way we have to start thinking about things. I saw Jatia had a question about the vaccine vans in the area. No, the issue has not been resolved. We know that the van will be at Beach 20th until March 10th. Okay. After that, I don't know, but we do know that they have closed at least 3 brick and mortar sites. City Field is closed. Okay, the library at South Ozone is closed. And I forget, I think outside of Queens is another site that's closed. And there are more closures to come of the brick and mortar vaccine hubs. I think the Museum of Natural History or one of those museums is also the other site that has been closed, but look for more closures where they will place vans and for how long they will place them in terms of vaccination vans and testing vans. We have to wait for that decision from the mayor's office.
Okay. Do we have any questions? Any more questions, comments? Open mic,
I have a question.
go ahead.
So do we not know at this point where people can get vaccinations?
Well, it's difficult to say the least, but right now for the Rockaways, we know that the van will be at Beach 20th until the 10th of March. Other areas in the city, I'm not sure of. The website seems to be outdated. I think the best way to find out where a van will be is to call 311. They might have more up-to-date information on a daily basis. St. John, yes, St. John Episcopal Hospital, but you have to check with the days that they are open. They are not open every day from what the team has been saying. Yeah, and pharmacies, and you have to check with them as well, because I think what they said today was that only pharmacies that have associated clinics are going to be the ones that will be giving vaccines. So all of this has to be, I would strongly suggest that you call before you go in or try to walk in, because things are changing rapidly. Okay, as the mayor makes decisions and as the leadership makes decisions in terms of closures and location sites for vaccination. So call before you go. Yeah, that would only be CVS. Yeah, because they have associated clinics. You're right.
Yes, and there are other, like the map that Dr. Coney showed, there are other doctors' offices, urgent care that have the vaccination. So if you know anyone that's having difficulty and locating a place that are ready to be vaccinated, you can bring it to our attention. They can call 311. If they're not successful, we'll be able to find them a location in the Rockaway, especially. Yes, where there's a will, there is a way.
Yes.
Do you know if that testing sites on in front of McDonald's, did they close or they're still there?
I didn't check recently. Sabrina or Walter, any of you, have you noticed?
The one by McDonald's is still open.
Okay.
And
It's still
Sorrentino
open.
is still open? Sorrentino?
And then sometimes they be right next to the train station, actually giving the COVID test too. Sometimes they come out. What was the name of that one? Walter Force something, I think it was. What is their name?
I don't remember the name.
The young man that you got up and asked, remember that day when we were sitting, what was his name? Force something. What was his name? The people that comes out.
Oh, anyway. Test and Trace Corps.
Yeah, Test and Trace Corps.
Okay.
Yeah, they be next to the train station.
Okay, so that was, thank you, Sabrina and Walter. That was as per the recommendations that you gave, and we passed that up the ladder to Dr. Ige's office, and she passed that over to Test and Trace. So that's why they're there.
Okay, the list.
I have a question,
Very good.
please.
You have a question? Okay,
yeah.
Go ahead.
Good night, everybody. What I'm asking is that if mask wearing is an overall must, or, you know, or you
It's
can check if you want, or if you don't want to, or what, if it's
it's
open.
Did you
really
come in late, Miss Ingrid?
Ah,
We had, okay, so
Go ahead.
answer the question, Dr. Connie.
No, go ahead. Go ahead.
Yes, so we answered the question a lot. I just want to know, did you just come in so I can know how to answer it? Did you just come in?
all right, you hear me?
Did you just join us or you were here from the beginning so I can know how to respond to your...
I came in about 15 minutes after because I was out. So as soon as I
Okay,
come
no
in,
problem, no problem. So we're saying that it's a recommendation that people can take off their mask, but nobody's forcing anyone to take off their mask. If you're not comfortable, you don't have to take off your mask. Don't allow anybody to make you feel bad for not taking off your mask. And we also recommended that even in making a decision to take off your mask, you want to know what is the infection rate in the areas that you're in. And we did state that in Far Rockaway, the infection rate is about 5% compared to the entire city that's like 2%. So that
all
means
right,
the infection rate is high in Rockaway. So you want to keep up your mask. Is our recommendation.
all right. So
Far
it's
Rockaway.
if that's the personal, if you want to keep it on or not, right? It's personal, right?
Yeah, you can keep it on.
All
Yeah,
right.
and if you don't have to listen to us, it's a recommendation. You can choose not to. You can choose to take it off. You can
Not
choose
me,
to leave it away.
I'm not taking off mine, my dears. I don't plan to do that in a hurry. Thank you.
And we also said for those that haven't been vaccinated, we want to recommend that they should keep their masks a little bit longer until we figure out what is going on with the mask off and where the numbers are gonna go. So if you haven't been vaccinated, you want to like keep your mask on is what we'll recommend. But or
So,
get
and-
vaccinated.
Yes. So, and I would recommend to everyone that, you know, the holidays are coming up. So develop a strategy, your own personal strategy for gatherings, and discuss it with your family and friends before you gather, so that everyone can be on one accord in terms of what you're going to do before gathering, because Easter is coming up April 17th. Okay. And so you want to have a strategy in place before you gather, so that everybody knows what you're going to do as a group, as a family, so that nobody is surprised. If you decide as a family that only vaccinated and that everybody get a test, you know, half an hour before you walk in the door, because all the at-home test kits are available, you know, then you do that. Encourage people to go back onto the White House website and order their second round of test kits. Okay, they released that today. So you can go and order 2 more test kits from the White House. And of course, we have test kits that we've been distributing. So you can develop your strategy for your family as to what you want to do before you gather for Easter.
Okay,
Have they
great
stopped
point.
giving vaccines at the schools? Have they stopped giving vaccines at the schools?
That's a good question. I know they were not giving it directly in the school. They have like how do you call it? Like vans that were like giving it. They were not like giving it in the school. The nurses were not giving it. They were just vans stationed by the school. So I don't know if those vans are still there. I gotta look at
Yeah,
that.
I don't believe so.
But I know they sent an update actually today. I didn't finish reading that update before I came to this meeting. But as far as I know, I don't think they.
No, I don't believe so. And remember that consent has to be given, right?
No.
Parental consent. So for children, for teenagers, I think is 16 and 17, they can do phone consent. But for younger than that, from 5 to 12, those children have to be accompanied by their legal guardian to give written consent. So
during the fall, they did go to schools and have
Yes.
testing. They gave out the consents to the students, and I know the school that I attend, that I work at, that they did. They had it for I think 3 different sessions, and the children had the first one, not that many. The second, more. By the third one, there was quite a few students that did get the vax. And these are elementary school students from kindergarten up, but at that time it was for the older children. So we go to the 5th grade, and it has not been any testing in the school lately, but they actually came into the school and the children were allowed to get the vaccine at that time. We have nothing now.
Excuse me.
Yeah, I knew they had about 700 sites in the New York City school at the beginning when they were pushing the vaccine at the school where we opened, but I don't think it didn't yield enough results that was expected, and I think that's why some of those things were pulled away, because it wasn't being used to its maximum potential. Thank you for sharing that. I didn't even know they were going inside the school. I know they were randomly testing kids. So you're saying that they actually came in and were doing vaccination inside the schools, or the parents had to come outside?
No, they actually came in. The parent, as a matter of fact, they encouraged the parents to be there with the children. If they had a consent, they would just test them and get the vaccine and send the children back to class. But it was only 1 or 2 parents that actually did that. The other parents were there with their child. And just like with adults, you know how you have to sit for that waiting time so they can see how monitor you, and they did that. And some came back upstairs, and other parents opted to take their children home and observe them themselves. We that was after December. I think December was the last time we actually had the testing in the building, and we have not had not the testing,
the vaccination.
Vaccination, yeah.
But we are still getting testing, but I see that even slowed down now. But they are giving all of the staff tests, the take-home test weekly, and N95 masks weekly. The new protocol with the kids, whenever we leave out on break, the children have to bring home 2 tests so they can test themselves before they come back in the building from any type of vacation.
Yes, and also like all the schools are on top of their game that I call the parent to remind them. I got a reminder call to get my daughter tested before sending her back, and emails went out and things like that. Yes, the city is doing all they can with the resources, but I think maybe in the nearest future, they might even consider revisiting, doing vaccination in the schools again, but I don't know what strategies will have to be used to make sure that more kids are getting vaccinated. So we have 4 minutes on the clock. So Brina, thank you, Ms. Kathy, for that comment. Thank you for sharing that thought. Very, very important. Ms. Sabrina?
Yes, real quick. The home vaccines, they're still in effect, because I know it works for me and Walter. We send a lot of families, and they took advantage and had their vaccine taken at the house, at their house. They still giving those?
That's a good question. We can follow up on that, especially since they are shutting down and closing stuff. We can ask that question.
I still went on the website last week and scheduled an appointment for someone. So I don't know if anything happened and it's not in effect. It will be from like maybe this week. But last week it was still working.
Yeah, we can follow up and check on that and see, since they're making all of these changes quite quickly. So we can follow up with that. I know they released a lot of the vendors that were doing this kind of work. So we need to follow up.
Okay.
Thank you.
And the most recent shipment of flyers that we got, one of those flyers has a number printed on it to help people locate vaccine sites.
Is it different from the previous numbers?
I don't remember.
I think
All
that's
right.
the up. I mean, just roll your sleeves up.
I don't remember. I know that I made a note of that only.
All right, so that's roll up your sleeve, send a package.
Oh,
Yeah.
they did?
Well, we have
Yes.
flyers. We have a lot of flyers that we make it with the
Yeah.
pack.
Yeah. All right.
Roll up your sleeve is for the
I'll check.
state.
Yeah, I'll check tomorrow. That would be the fastest that we ever received flyers from the state.
Really? They sent a flyer already within a month, like 3 weeks? Oh,
Not
okay.
even 3 weeks
Well,
or
we're
1 week.
streaming live. Let's be nice. We're streaming
Yeah.
live. Let's be nice. Wow, that is so wonderful that they send the flyer. We truly appreciate that. That is
Yes,
so
we do.
kind of
We
them. We
do.
do appreciate it.
We
That's
really
number
do.
one. Mhm. Okay, so we're gonna call it a night. It's 2 minutes to 8. It's been a wonderful conversation with you, good and great people. So thank you very much for joining us, and we see you guys same location on Monday. Invite someone because these are great information. I put the link of this meeting in the chat. You can copy it and share it. It's live on YouTube, and anybody can listen to
What
it.
about the White House link?
The White House link.
Let me see if I can find the White
If you
House.
can find it and you put it in the chat, I'll actually put it on the YouTube link. So whoever, I'll put it on the YouTube. So whoever goes to see it, you know, they can see it in perpetuity.
A second, let me see if I can.
We'll try to pull that up quickly. Let
I'm
me see.
having trouble copying it. Let me just see.
I'm not sure why it wasn't downloading on my phone, on my computer. Okay, there you go. Maybe I can.
Let me put this here. Okay, that's it.
Get it? Okay. Oh. I think we're actually gonna copy it and put it in the chat. Let me see. Let's see if that will happen. Okay. Oh, you did put it in the chat. I was
Yeah.
looking. That's great. Okay, you know what happened? My own, the one I was trying to download opened up. So when I saw that, I thought that was the one you were showing. So I'm gonna put that on the YouTube. Hold on before we get up in live. Where is it? I think I closed YouTube on my computer. Okay, right here. Okay, excellent. Okay. Okay. Oh, we had some
wonderful
audience. Okay, excellent. Okay, so thank you, everyone.
Thanks, everybody.
Okay, have a great evening. We'll talk to you soon.
Good night, everybody.
Good night. Thank you so much.
Bye.
Thank you so much.
Good night, all.
Reloom team,
night.
thank you so much for everything that you do. I appreciate you.
Thank you for all that.
Appreciate.
Still
Thank you,
appreciated.
Brother Delroy.
Yes, thank you.
Sister Michelle.
Have a good night, everyone.
Good night. Thank you. Bye-bye.